This is Dr. Lisa with Private Practice Made Easy, Your Turn to Lead. And in this video, we are going to talk about AI and whether or not it can replace NPs. And I came across this website called Abby. It offers all kinds of therapy. It's an AI therapy website. And it's got psychodynamic therapy. For those of you who don't know what psychodynamic therapy is, it's talk therapy, but a little bit more complex because it actually focuses on exploring unconscious processes, past experiences, emotional conflicts, especially those things that are rooted in childhood and relationships to kind of help the patient or individual gain insight into their own thoughts. So it has a lot to do with the unconscious mind. And then it's even got CBT, dialectic behavioral therapy, Gestalt, and Adlerian therapy. For those of you who are not familiar with Adlerian therapy, that's just really looking at the holistic view of a person, not just a collection of symptoms, but really looking at thoughts, feelings, behaviors, and social influences and how they're all interconnected. The topics are basically everything we treat in mental health: depression, anxiety, stress, self esteem, relationship, trauma, bipolar. And then it even goes into like loneliness, bullying, substance use, alcohol and recovery, work life balance, relationship conflicts, procrastination, which really has to do with ADHD, low self esteem as well. And this is they're 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 focusing on individuals and universities and healthcare individuals, corporate wellness. I think this is a start of something pretty dynamic. And when they talk about replacing jobs, it does make me wonder whether or not the therapist um, job is sort of at risk here. Because we keep hearing the same headlines. AI is coming for your job. In the world of mental health, that fear feels real. It feels real, real. AI is already doing therapy like tasks, as we can see. So maybe the AI may supplement therapists, but nurse practitioners aren't going anywhere. And we'll talk about that in a minute, why nurse practitioners aren't going anywhere and why this is a good time to open up your own practice. But let's just kind of get into this a little bit because this is real interesting. So it says start chatting today. So I click on start chatting today. Will it let me? I don't think it's going to let me. Let's see. Oh, I got to register. So let me just put in Dr. Lisa. And I'm going to put in my info at turningpointpsychiatry.com. And let me just put in a password. So this is how we register. Boom. Oops, password didn't work. We must have to add a symbol at some point. There we go. Okay. You guys, this is going to wow you. I did this earlier today and I was like, OMG. Okay. Hey, I'm Abby. Let's continue. What's your name? Dr. Lisa. Great to meet you, Dr. Lisa. Before we start customizing your algorithm, I'd like to tell you a few things about how this works. So it's going to tell me how this works. I know that every person is unique, so your experience with me should be fully customized to be truly effective. After a few quick steps, we'll start tailoring your algorithm together. The more we talk, the better I'll understand your story, challenges, and perspective. My AI gets smarter with every conversation, adapting to fit your needs in real time. Whether it's daily frustrations, overwhelming challenges, or past traumas, I'm here to listen and help you make sense of it all. Our chats are a private, safe, and judgment free space. And I really think this is an advantage of AI. There definitely is no judgment. I've been trained on over 7,800 therapy books and research papers. OMG. Okay, I've had a lot of training. I don't know that I've had training for 7,800 therapy books and research papers. I've had a lot though. Um, I can reference almost everything that's been written about therapy to help with whatever's bothering you. Whoa. Okay, I'm impressed. One quick fact: in a recent study from Stanford University, over 83% of people feel better after using AI therapy. Okay, that's a good percentage. I know it doesn't have the human touch, but wait, let's find out. Let's find out. Let's customize your algorithm to fit your goals and preferred style. You can always change these settings later. All right, here we go. Let's begin. Okay, so what's your experience level with therapy? Just getting started. I have some experience. I have significant experience, regular therapy. You know what? Let's go here. I have regular experience. Earlier, I said I'm just getting started. So let's go over here. So I have a lot of experience in therapy. Okay. So it's optimizing for advanced therapeutic needs. Okay. Who do you want me to be? OMG again. So we can get a professional therapist, which is going to compile clinical evidence based and structured um, research. So, an empathetic friend who doesn't need that. Sometimes I need a tough coach too to be firm with me. Mindfulness guru, so something more calming and spiritual, something more practical, like a problem solver, or a philosophical guide. I don't know. What do you think? So earlier, I did professional therapist. Um, let's do problem solver. How about that? Let's do problem solver. Loading problem solving frameworks. Okay. Okay, so these are some of the types of therapies, excuse me. So, hmm, I need a solution, goal oriented. Let's do that. And I'm just going to make up something here. How should I respond to you? Choose your preferred communication tone. So I want warm, nurturing. Oh my goodness, I love this. Warm, nurturing, professional, formal, casual, friendly, direct, straightforward, empowering and motivational, and balanced and adaptable. And that's how we choose our therapist. Like we might want a therapist that's, really friendly and inspiring or motivational, or we might need someone really firm, or we want something real structured. Um, let's go for direct and straightforward. Well, yeah, let's go for direct and straightforward. So we're going to get clear, concise responses. Well, you know what? The more I think about this, I did professional and formal earlier. Let's go for more casual and friendly because I think these are closer. Let's do casual and friendly. Okay, setting up friendly conversation. Okay, so it's going to be, do you want content from quotes? No. Research articles, maybe. Podcasts, blog posts, Reddit threads, or videos. Let's go for research. Okay, so they've got all my preferences, so let's start chatting. Download therapeutic research papers, building personalized knowledge, training, neutral network, synthesizing my personality matrix. Whoops. Okay, thank you for choosing. We care about your safety. Okay, so this is more protection here, right? So thank you for choosing our AI support system. Please note that while our AI is designed to provide guidance and emotional support, it is not a substitute for professional medical or mental health care. So if you need something more, call 911. Okay, got it. How it works. Keep the conversation going until you reach the road map milestone around 20 messages. By then, Abby will have enough insight to really understand your story and craft personalized strategies, advice, and deeper topics just for you. Get started. Okay, so hey, Lisa, Dr. Lisa, I'm Abby. What's been on your mind? Okay, so let's just kind of make up something here. I am struggling with conflicts at work. I want to avoid them. Let's see, I'm having a lot of, I'm taking off time from work to avoid conflicts. I am starting to feel depressed. I am anxious and had 2 panic attacks in the past week. Okay, let's see what happens. We notice you mentioned a topic that may require immediate attention. There we go. There we go. While Abby is here to provide support and guidance, it's not a substitute for a professional medical and mental health. You see, nurse practitioners are not going to be replaced by AI. This is where they're telling you you need to go see a professional. And it's agreeing that you acknowledge that Abby is not a crisis service and agree to use it as supplementary tool. Okay. I'm really sorry to hear you're going through this. Work conflicts can be tough to handle, especially when they affect your mental well-being. Can you tell me more about what's been happening at your workplace that's contributing to these conflicts? Okay. I have deadlines that are impossible to meet. I have complex projects that require additional time that not granted. I have been at this job for 10 years and fear leaving. There we go. Okay. Oh, that sounds incredibly challenging. Working in an environment with impossible deadlines and not enough time can really take a toll. The fear of leaving after being somewhere for so long is understandable too. How do these pressures at work impact your daily life outside of the office? Um, I am irritable, and my husband states that I have been impossible to live with. It sounds like the stress from work is seeping into your personal life, which must be tough to manage. Feeling irritable can strain relationships, especially with those closest to you. How does this situation with your husband make you feel? Okay, so notice it's asking questions just like a therapist. It makes me feel deflated. That makes sense. Feeling deflated can be really tough to handle, especially when it's affecting things at home. Can you tell me more about your relationship with your husband and how you both usually handle stress or conflict? We have good communication and like to work out. Okay, that's a positive sign that you both have a foundation of good communication, enjoy working things out together. It seems like you both have the tools to navigate through challenges, but work conflicts might be adding additional or extra stress. Can I ask a little about your background? Okay, very good. Before we dive deeper into what's going on. Sure. Okay. Have you faced similar challenges in previous job or situations? Or is this current job an exception in terms of stress and conflict? I think this is an exception. This is an exception. You know what I'm going to ask? I'm going to ask, do you think I need medication? Understandable to think about medication, especially when you're dealing with work, stress, anxiety, and mood issues, but it's really important to talk with a healthcare professional who can give you personalized advice based on a full picture of your health. Have you spoken to a doctor or therapist about your anxiety and mood changes yet? No. Should should I? It might be beneficial to reach out to a healthcare professional. They can help evaluate that you're experiencing what you're experiencing and work with you to find the best approach to feel better. Speaking with someone trained in dealing with anxiety and mood changes can provide clarity and support. How would you feel about making an appointment to talk through this with a professional? I think that is a good idea. Okay. Creating your customized discussion roadmap. You're facing work pressure when you mention deadlines that are impossible to meet. I notice this may be part of a larger pattern of workplace stress impacting your well-being. How long have these work pressures been affecting you? What steps have you previously taken? Can you identify? So I think you just ask questions. What I was really getting at is I think this is a great tool for someone to use that has like mild anxiety or needs to like talk through some things or get a better perception of what's going on in their life. But if we have someone with major depressive disorder, generalized anxiety where they're having panic attacks, they need to see a healthcare provider, which they did, a licensed healthcare provider, which they did indicate that that is an option I need to think about. So interesting. So and there's a 7-day free trial. I was just going to say, this has all been free. I haven't paid for anything. All right. So let's let's think about this. AI tools are showing promise in delivering some therapeutic support here. So I think there is some concern. They offer 24/7. So if I wake up in the middle of the night and I need somebody to talk to, or I need to just like some talk therapy, there's no wait list, there's no judgment. It's a cost of, I think it's like $20. We can look at the cost here. Let me see. 7-day. Here we go. So traditional therapy is 150 to 300 per session. This is $20 a month, unlimited, 24/7, instant support, 100% private and anonymous, always here for you. And again, I don't think this takes the human it takes the human touch out of this. Absolutely. But there are some people that probably would prefer something like this. So we're talking, if you bill it annually, it's $14.99 a month. So for someone who can't afford traditional therapy, I think this is a great option. It says no payment due now. You can try this for 7 days. So that's great for accessibility. It's great for cost. But there's limits, right? There's limits. And so let me just go back over here real quick to my whiteboard because it's we're not going to replace we're not going to replace nurse practitioners. And I'm going to show you why. It AI cannot prescribe medications. It can't manage complex psychiatric disorders, and it absolutely can't replace federally licensed providers. So this is a great time for you as a nurse practitioner to go out there and start your own practice because AI requires federal um, and state licensure. So there's no DEA license. There's no state nurse practice acts for AI. Medicare and Medicaid, it's not able to diagnose and treat. There's a scope of practice. The Board of Nursing is not going to go for this. And complex crisis intervention, it's not going to be able to be there to give the medication in a crisis. So I think it's safe to say that nurse practitioners will not be replaced. Will they help us? Absolutely. They are helping me. AI is helping me right now with my notes. When I help nurse practitioners start their private practice, I'm using AI for their logo. I'm using AI for their website. I'm using AI for all their policies and procedures. It saves me so much time. Like we literally can get this done in seconds and minutes, and within an hour I can get the website up. It's unbelievable how it can help, but it's not going to replace nurse practitioners. So if you are a nurse practitioner and you want to open your private practice, this is job security, because while therapists might worry about automation, um, talk therapy, nurse practitioners are protected by regulation and they're actually empowered by legislation. We are medical providers. We prescribe. and we are leaders in the future of mental health and family health care. So if you are a nurse practitioner wondering about your future in the age of AI, don't worry about being replaced. Focus on being ready and learning how to use AI. Learn how to use AI. All right, then. I think we answered this question. I hope this of whether or not AI can replace nurse practitioners. Please comment and subscribe. And we're going to talk more about AI and how it can help you as a nurse practitioner set up your practice. And I think that's going to be the next video that I do, AI and how it can help you actually launch your practice.